Hi guys, this is Dr. Bhupesh once again from Dr. BKM OIT Institute. Please subscribe our channel if you have not. We are doing second recording of the day. Normally I record only one recording for 5 to 10 minutes, but I am doing one more question because that's a very special question. The question when it comes to purpose, what is the objective? What is the purpose? What is memo saying? MEMO. What is memo saying? What is the crux? CRUX. What is the gist? GIST. What is the summary of the paragraph? Purpose, summary, objective, motto, aim. These are the questions. Again, I always say that in these kind of question, last line is the most important line. First line, because it is the introduction topic, so it obviously talks something about the topic, but last line is the conclusive line that always changes everything. So this is a very special question. That's why I'm recording the second one of the day. Normally I would record only one recording, but yeah, that's fine for today. What is the purpose of this extract? So when you read, never ever miss the last line. So extract said debridement is the removal of the non-viable tissue. Sharp debridement, method number one, quick method, but only be carried out by the competent practitioner and may be appropriate for all the patients. So positive thing, quick, negative thing, competent practitioner is required. Autolytic debridement, other methods of debridement is often used before other methods. So it is maybe the first method, autolytic. Product that can be used, autolytic are hydrogels, this and this. Hydrosurgery systems combine lavage with the sharp debridement, provide a safe and effective technique, positive, which can be used in the ward environment. This has been shown to precisely target damaged and necrotic tissue and is associated with the reduced procedure time. All right. Again, positive, reduced procedure time. So they're talking about the autolytic positivity. They're talking about sharp debridement, positive points. Ultrasonic debridement is a relatively painless method of removing known and has been shown to be effective in reducing bacterial burden with earlier transition. Positive again, they are talking about the positive thing of ultrasonic. However, the last two methods are potentially expensive and equipment may not always be available. That is the negative point. So they were talking about the positive and negatives of various methods. Like in the sharp, it is positive, but competent practitioner is required. Autolytic, it is the first one, but it is expensive. Ultrasonic, again, it removes, the bacterial burden, but again, it is expensive and equipment may not be available. So they were talking about the advantage and disadvantage of particular person. And most of the people will do C because to explain which methods are appropriate for dealing with what type of wounds, which type of wounds. So maybe they are talking about the methods and they are talking about which type of wounds these methods are better. But if you will see, they are not talking about which type of wound. That is also in purpose wala questions, you don't need elimination because you see all the positive, then in the last you have seen negative thing. So they're talking about advantage and disadvantage of particular procedures. But if you want to use elimination method also in purpose wala questions, then this is perfect. Okay, I will ask you now which type of wounds. So you will not find any type. First method is available for all patients. These methods, they are not talking about any type of wound. They are only saying target damaged and necrotic tissue. And the third one, they are talking bit about bacterial burden. But they are not talking particularly about which type of wound. Dry wounds, exudating wounds, wet wounds, something else, bacterial, viral wounds, but what kind of wounds? Means if you will read it again and again, you will get to know there nothing like type of wounds given. But some people will do see. I understand. So I won't say this is a very easy question, but this is what we need to learn. In purpose wala question, always give value to the last line. So in purpose wala question, you don't have to use elimination. You use this line. The last two methods are potentially expensive. That means they're talking about disadvantage of. And overall, he was talking about the advantage. I hope you all learned. Again, listening to one time will not fetch us anything. Listen to it at least 3 times. This is Dr. Bhupesh from Dr. BKM Institute. Thank you.